All right, rock and roll. Today is May 28th. Um, Hope everyone is doing well. There you are.
Hi.
Hello, how are you?
Good. How are you?
All right, everything going well
Yeah.
overall?
Yeah.
So you wanted to talk to me about Minnie. She's been doing well since surgery, but now she's showing different symptoms.
Yeah. She had her surgery a few years ago, I think in 2017, and everything was great. And then last summer, she actually fell, like she had an accident, she fell, and I brought her back to you. But we didn't have to do surgery again. We just like crate rested her, and everything was fine. But since then, I feel like I've noticed just like a bunch of changes in her, um, and mostly with like her cognitive sort of function.
Okay.
And I know she's old. I don't know exactly how old she is. When we got her, she was 7 or 8, since she was a rescue, and that was 10 years ago. So she's probably 17 or 18. So I know that like it's expected for her, because she's so old. But just lately, it's gotten sort of really bad where I mean she gets stuck in corners when she's walking around and she sort of walks in circles and things like that. But she started doing this sort of like thing with her tongue that she like flicks it in and out of her mouth. So I've asked a couple of vets, and at first they were like, oh, it's because she doesn't have any teeth, so it's like bothering her. And then I did like the dental. I mean, she only has 2 teeth, so they couldn't really do anything. Then they like shaved her mouth. They thought the hair was bothering her. And then they were just like, oh, this has to be a neurological like tick that's happening with her. And so that's sort of like the main thing, like one of the main things, because I think that is like really bothering her. She sort of walks around doing it and like whining, and it wakes her up from sleep, and then she can't really go back to sleep. And then the other part is like her sleep cycle is totally like reversed. So she's waking up like every hour at night. And so about 5 or 6 weeks ago, I started her on Anapril,
Okay.
and I've been giving her the 10 milligram dose, half of a pill every morning. I started at a quarter tab and then bumped it up to half when the vet said after a few weeks, if you don't see anything. The half tab doesn't really seem to be doing anything either. And then I have her on some other things like, CBD, and it's like anything I try just like goes right through her. It doesn't really do anything. Um, so yeah, I mean, I just feel like she's not really getting any rest. And frankly, like I'm a really light sleeper and I'm up with her every hour at night. She also like shivers a lot when she's sleeping, and so I thought it was because she was cold, but then like I'll put a sweater or I'll put a blanket and it's not that. And then as soon as I feed her something, she stops shivering and she goes right back to sleep. And so then I thought maybe it's some sort of like insulin issue, sorry, some sort of insulin issue, or something with blood work. All her blood work's normal. So yeah, but they did, my vet did say that she has all of the signs of the canine cognitive dysfunction. So I just wanted to know sort of recommendations or like sort of treatment options or what the prognosis is, and if this is just something that because she's so old, like I'm just gonna have to deal with it type of thing.
Yeah, definitely. So to me, it sounds like kind of kind of two things to talk about. One would be cognitive dysfunction syndrome in general, and then specifically as it relates to Minnie. And we'll talk a little bit about what that is and what the symptoms are and how you diagnose it, and then what the treatment and prognosis is. And then sort of related would be this licking, which my gut feels that the licking is unrelated to cognitive dysfunction syndrome. So cognitive dysfunction syndrome is kind of like the doggy equivalent of Alzheimer's disease. So
Right.
we classically see it in older animals, and it's a progressive, sometimes quickly, but usually slowly progressive decline in their cognitive function. So lots of the symptoms that you're describing, being disoriented, walking around, pacing, getting stuck in corners, seeming confused, having poop and pee accidents, where she wouldn't do that before, and then being up at night and sleeping during the day, or just being up all the time, are kind of all of the typical symptoms of cognitive dysfunction syndrome in dogs. We usually don't see this licking as part of cognitive dysfunction syndrome. So we'll talk about that separate of what that could be. But it's not one of the classic symptoms of cognitive dysfunction syndrome.
Okay.
So I wouldn't necessarily lump that in with it. Cognitive dysfunction syndrome, again, we classically see it in older dogs. We talked about the classic symptoms. There are other things that can cause older dogs to be lethargic, seem confused, get stuck in corners, etc. And those two things would either be something metabolic or something elsewhere in the body that's affecting the brain, which I think is, one, it's just much less common. But since Minnie has normal blood work, we can pretty comfortably cross that off of our list. But things that we think about had you not done blood work would have been things like low blood sugar or severe liver problems.
Yeah, so she, in terms of liver, she's on Denemerin, which I think is just like a sort of like a vitamin, but I know her liver levels are usually, is it high? Like if it's high is when it's bad?
So it's most likely that she has elevated or high liver enzymes, and if she's
Right.
on Denemerin, they're most likely treating an elevated ALP or alk phos. So they, it's tough for me to know what her liver function is. Usually that would be something that we would do a bile acids test, but
Okay.
that's what I'm talking about more, when the liver's not functioning and toxins are building up and can cause a dog to act abnormal. Just
Okay.
much less likely, but from Minnie's standpoint, something like a bile acids test would be something relatively non-invasive and relatively inexpensive to kind of just cross out all of the things outside of the brain.
Okay.
The second thing that would potentially cause symptoms similar to cognitive dysfunction syndrome would be a physical problem in the brain. So older dogs also get things like brain tumors that can cause many of the symptoms you're describing, behavior changes, walking in circles, getting stuck in corners. I think in Minnie's case, it's less likely, but just in general, for other people might be watching this and their dog might be walking in circles, I don't want them to be, thinking, well, gosh, it's always cognitive dysfunction.
Right.
So those are things that we rule out with blood tests to look outside of the brain, and then an MRI to look at the brain. And an MRI would show things like a brain tumor, a stroke, but it can also show us changes consistent with cognitive dysfunction syndrome. So cognitive dysfunction syndrome, many times we can have a completely normal brain MRI, but many times we also see abnormalities on the MRI. We can see atrophy of the brain. So the brain, for lack of a better term, is just shrinking or getting smaller. And when we see that, the fluid spaces of the brain, what we call the ventricles, can look bigger, and the spaces or the grooves of the brain, what we call sulci, get wider. So there are changes that we can see on a MRI that would be supportive of a diagnosis of cognitive dysfunction syndrome.
And so how quickly do those changes occur? So like when she had the cervical spine surgery, the MRI did, you had done an MRI on her brain as well, and everything was fine.
Right.
With her brain. So, I mean, that was a few years ago. Is that something that could have developed in the past couple of years, or is that something that takes a really long time to happen?
I think the truth of the matter is no one really knows, in that we're not taking normal dogs and MRIing them every 6 months their entire life. And but certainly, I mean, her MRI was in 2016, 2017?
17, I think, yeah.
Certainly in 3 years, things can change, because you've also seen the symptoms change, relatively quickly over that time. So I would be comfortable that, is there the potential that an MRI today would show something very different than 3 years ago? And could that be cognitive dysfunction syndrome? Absolutely. So treatment was something we were going to talk about. because you had said you're giving her the Anapril, and you're trying some other things. The short answer is I don't think there's any great treatment. There's no cure for cognitive dysfunction syndrome in dogs. Similarly, there's no cure for Alzheimer's in people. But there are medications that have been tried, and the selegiline is one of them. I personally haven't had a lot of positive experience with it. So usually for dogs that I'm meeting and having this conversation in person on a dog that I'm either suspecting based off of consultation or diagnosed based off of MRI, I'll talk with the pet parent about selegiline, but I usually kind of follow it up with, the response is very, 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 very variable. And I usually don't see a dramatic improvement, which is similar to what you sort of described, where you were on, was it a half pill and you didn't see anything and now you bumped up to a whole, or had you said a quarter and then a half?
Yeah, it was a quarter and then a half.
Okay. So other things have been tried, most of which are anecdotal, things like pain medications, anti-anxiety, things like the CBD. I assume you're giving that from an anxiety standpoint. I have clients and veterinarians that have tried things like melatonin to help with sleeping.
Yeah, I give her melatonin too.
And some owners, most of them say what your head just said there, where I haven't really seen an improvement. The reality, most of these things aren't going to hurt, but I try and prepare my clients that the likelihood is that it's not going to help either. Okay. There is some evidence that certain diets, so diets rich in antioxidants, diets rich in essential fatty acids, things like that can help. Things like new toys, new games, just interacting to get her mind, working are things that we can be doing. With regards to her tongue licking, kind of my interpretation of the video, yeah, you can see she doesn't have a lot of teeth. Yeah. And that would be one thought to me. I'll often I've seen dogs without teeth that just kind of lick a lot. Keeping our mind open, are there things like seizure disorders that can cause this sort of repetitive movement of the mouth and the licking? Sure. Based on the video you're sending me, I think it's much, much less likely. Okay. But again, just for other people that are looking at this, just to keep our mind open, there are other things that can cause this repetitive licking, other than dental disease, other than seizure disorders. Occasionally we'll see it as a behavioral disorder where dogs sort of biting at the air or licking at the air. So I think you're doing the logical things with regards to the licking in her mouth. My gut feel is that it's not related to the
neurological problem. I mean, so my vet had suggested trying to put her on trazodone at night only, really, to see if that would help. Is that something?
I think that's perfectly reasonable. Usually, so there's a dose range that your vet will give you, and we usually start off kind of at the low dose and see how that affects an animal, and then titrate up from there. Okay. Okay. So yeah, I think that's worth trying.
Okay, sounds good.
Okay.
All right. Thank you so much.
Great seeing you. Take care.
All right. Bye.
Bye. Hello. How are you?
So we are from Brookings, Oregon. So that's the coast of Oregon, and I have a Husky Lab mix. She's 9 years old. Her name's Hannah. She's been in fairly good health throughout her life. Just a quick backstory. About a year ago when we went camping, she jumped out of my husband's truck, which is a Dodge 2500, so a big truck. She at the time broke her toe, and she received some scratches on her head. And when they ran the blood work and tests, they didn't find any kind of head injury or brain damage or anything like that. We started noticing right after that. She pretty much started to change. She started to get a little bit kind of mopey. And we kind of just assumed, you know, she's got arthritis from the injury. About a month ago, she went from being a perfectly healthy dog to about 2:30 in the morning, she had a 5-minute seizure. She bounced back right away at that time, lasted for about a week, and then she had another seizure. I took her to the vet. They ran blood work, they checked her physically. They said that for 9 years old, she looked perfect, and there was no reason for why she should be having seizures other than maybe like a late onset epilepsy, but they said at 9 years old that was rare. Um, my question is, they stated that sometimes brain tumors and brain cancers won't always show up on blood work right away. Um, because of the seizures, she's went blind. She seems very confused. She is on phenobarbital, but even cutting that back has not really done much for her. Um, I just feel like we've lost our dog. I feel like there's nothing that I can do, and they've explained to me that even with an MRI, it might be too late for her.
Erica,
So,
if you can hear me, the thing froze.
okay. What I was asking in regards to this is, she had blood work after having some seizures, and they put her on phenobarbital, and they explained that it's rare for a dog to have epilepsy at 9 years old, just because that usually seizures are leading to something else. But she's had several doctor's visits, several blood draws, and there's no indicator one way or another why she would be having seizures. Our last bet has been to maybe get an MRI and see if there's a tumor or cancer spreading. But I don't know, are there signs for me to look for? I guess my question is, you know, she's had these seizures. I don't know if this could have come from her jumping out of the truck last year. Maybe she got some kind of a brain injury that was missed, or if this is typical of maybe the sign of a brain tumor with her pacing, and she has a little bit of face pain, and she seems confused, and she's lost her sight. There's just a lot of textbook things that sounds like it's leading up to a brain tumor, but nothing is coming back as a brain tumor or cancer.
So, is she constantly blind now, or is she only blind right after the seizure?
She's, from what we can tell, she might be able to see shadow.
Okay.
Um, but it seems with the way she walks around that she's blind. She does run into things. She familiarized herself with the house, but if I move something, she'll walk into it. So I do believe that her sight's gone. She doesn't see treats when I lay them down in front of her. And she acts like when she does try to eat the treats, unless I hold them at nose level for her to eat them out of my hand, if I lay them on the floor, she doesn't want anything to do with that. Like maybe pain or can't see, I'm not sure.
Sure. So I'll probably, tell you some stuff that your vets have already told you. So I apologize if I repeat anything, but what a seizure is a abnormal burst of electrical activity in the front part of the brain, what we call the cerebral cortex. And normally there's this electrical activity, but what a seizure is when there's too much and it's all happening right at the same time. And what we see on the outside when a dog is having this abnormal electrical activity, they can go stiff, they fall on their side, they paddle, they might poop, they might pee. It can last anywhere from a few seconds to several minutes, like what Hannah's doing, where she had that 5-minute seizure. In general, there are 3 main things that cause seizures. I think of them as things outside of the brain, things like low blood sugar or liver problems or severe kidney problems or severe electrolyte abnormalities. So those are things that you've already tested for with the blood work. So we can relatively confidently cross those things off of our list. The second main cause of seizures is something physically wrong inside of the brain. So as an example, things like a brain tumor or a stroke or an infection in the brain or inflammation of the brain, what we call encephalitis. So those are all things that can cause seizures. And then the third main cause of seizures is idiopathic epilepsy, and that just means recurrent seizures that we don't find a physical problem in the brain and we don't find a blood work problem outside of the brain. So it's a diagnosis of exclusion, meaning we need to rule out things outside of the brain and rule out things inside of the brain. But there are a couple generalizations that we can make about dogs with seizures, about dogs with idiopathic epilepsy. Usually they're between 1 and 5 years of age when they have their first seizure. Not all dogs. I see 6, 7, 8, 9, 10-year-old dogs that have new seizures that I end up diagnosing with epilepsy. So we can get as you called it, a late onset epilepsy. It's possible, but just less likely based on her age. The second generalization we can make about idiopathic epilepsy is they usually have kind of these whole body, full violent seizures. So what we call generalized clonic-tonic seizures. So that certainly sounds like it fits with Hannah. The third generalization that we make about dogs with epilepsy, they usually have a normal examination. I'm not able to examine her, but when I hear things like, confusion, pacing around the house, bumping into things, acting blind, and not just right after the seizure, that's somewhat expected. After a 5-minute seizure, we might be very disoriented or act blind right after the seizure, but the next day, a week later, something like that, we shouldn't still be walking around confused, blind, bumping into things. Those are the things that do make us worried that in Hannah's case, would this be something inside of the brain? Not necessarily a brain tumor, but just meaning that it's not epilepsy. Again, her age, not between 1 and 5 years of age. And then 2, just the abnormalities in between seizures. So the change in personality, the blindness, the bumping into things, etc., the pain. We can't know that it's a brain tumor just by hearing that she's a 9-year-old dog with recent onset seizures. So in theory, seizures can come on at 9 years of age because of a brain injury. I do not think that this is due to the jumping out of the car a year ago. Usually if there was a brain injury from trauma, we're going to be abnormal at that time. We're going to at least have been, knocked out, signs of a concussion, something like that, seizures back then. I don't think something that happened a year ago is causing seizures that started a month ago. It's not necessarily always a brain tumor if you have a 9-year-old dog with recent onset seizures. We can see things like strokes. We can see things like encephalitis. We can see things like infections of the brain. So those are all possible causes. But yes, the most common thing in a 9-year-old dog with recent onset seizures that is also neurologically abnormal is something like a brain tumor. Even within the diagnosis of a brain tumor, so without being sure that it's a brain tumor, without having done an MRI, it's hard to say, 1, is it a brain tumor? And 2, what type of brain tumor is it? Is it a big one? Is it a little one? Is it located in an area that we have more treatment options versus ones that are located in areas that we have less treatment options? Different types of brain tumors behave differently, and we've got better chances of treating some versus others. We've got, better prognosis for some versus others. So even within the diagnosis of brain tumor, there are good brain tumors and bad brain tumors. So from a phenobarbital standpoint, phenobarbital can cause things like being lethargic and walking wobbly, but usually that's just for the first couple weeks, first week, maybe 2 weeks after starting the medication. I don't know how big of a husky she is, but if she's getting 100 milligrams, one time per day or 2 times per day?
She started off 200 milligrams, 100 in the morning, 100 at night. And they felt it was too strong for her. She's 81 pounds. They cut her back to a half a pill in the morning and a half at night. So she's on 100 total a day.
100 total per day. Okay. So originally she was on 100 in the morning, 100 at night. Now she's on 50 in the morning, 50 at night. Okay.
Yeah, so she was on, she took 200 a day.
Yeah. So, as the book goes, so we base phenobarbital doses based off of the dog's weight. It's kind of as a starting dose, and 200 milligrams per day based off of 40 kilos would be a reasonable starting dose. But then we decide based off of how that dog's reacting. You know, are they super sedate on it? How they're reacting with regards to has it helped with the seizures, etc. So my starting dose would have been something like 100 twice a day. You know, your veterinarian's able to assess her better to say, is 50 twice a day more appropriate? You know, to me, that's a little on the low side, but if she's not having seizures, if she's having severe side effects, if her phenobarbital level is in the therapeutic range, those would be things that we would also take into account other than just the actual number. So related to broken toe, I don't think it's related to the broken toe. We kind of talked about causes of seizures. The concern would be for something inside of the brain, just based off of you've done blood work that have ruled things outside of the brain out, and just based off of age and behavior changes, it's less likely that she's an epileptic. So we would be more concerned about a problem inside of the brain. We don't know what that is without doing an MRI. So an MRI is absolutely warranted for Hannah. The way I describe it to people is, you know, if you or I started having seizures, or if our parents started having seizures, you know, we would do blood work to make sure there's not something outside of the brain, but then we would be moving towards an MRI. And that gives us the best chance of knowing what the cause is. And by knowing what the cause is, we can better say, well, what's the best treatment? And we can also just coach the parent on, well, this is what we can do, this is what we can't do, this is the likelihood of getting better, etc.
Okay.
Seizures in general, we don't expect to stop all seizures. Our goal is to decrease how often the seizures are happening, how severe they are, how long each one lasts. And we're sort of balancing that with the side effects of the medication and the downsides of, you know, of mom having to give the medication. So, but to me, the biggest thing going on right now is the behavior changes, the blindness, etc. I'd encourage you to, if there's a neurologist in your area, I'm not able to prescribe medications or make, you know, strong medical recommendations, you know, having not met Hannah in person. So I can't recommend medications or anything like that, but a neurologist in your area would be able to do that. And there are a handful of other medications that, you know, if she's not agreeing with phenobarbital, there are other seizure medications that have a different side effects, that if we're continuing to have seizures and phenobarbital isn't agreeing with her, there are other medications there that you can talk about with your vet and with the neurologist. And then sometimes dogs that have, that we have a concern for a structural problem in the brain, like a brain tumor, sometimes it's reasonable to try something like prednisone. Prednisone is a steroid that takes away swelling around whatever the problem is, whether it's inflammation, stroke, tumor, etc. So it can make a lot of things look better, but it's kind of a Band-Aid. It's not going to treat a tumor. It's not going to treat an infection. It's not going to treat inflammation, but it might make her look better, act better, see better. So that would be something to talk about with a veterinarian in your area about.
Okay, and is there anything in regards to blood work? She goes next week for blood work, so is there anything that I should look at and changes if there's like some kind of brain activity? They are going to test her levels in a few days.
Good question, and was something that you had said before that I didn't touch on. You can't. There's no blood test for a brain tumor. So the only way that we can diagnose a brain tumor is with, you know, advanced imaging such as an MRI. So the blood tests that your vet's doing, it's accomplishing several things. One, looking for causes outside of the brain. Two, Sometimes dogs that we give drugs for seizures, we can run into side effects. It's really uncommon with phenobarbital, but we can run into things like problems with the bone marrow or problems with the liver. So that would be another reason that blood work, follow-up blood work could and should be done, is to make sure that we're not running into other problems. Most dogs on phenobarbital will see one of the liver enzymes, the ALP or alk phos, can get really high. And that doesn't necessarily mean that there's liver damage. So that's just one thing I'd prepare you for. If you do this blood work and the ALP is high, it doesn't necessarily mean that she's having a problem with the phenobarbital. Things like a belly ultrasound and what's called a bile acids test give a better indicator of how the liver is functioning. Again, I'm probably 3 steps ahead of what we need to be talking about. I guess the other potential blood test that would make sense for Hannah would be a phenobarbital level. So again, we give phenobarbital based off of how much she weighs. There's a dose range, and we'll often start off at the low dose and then decide based off of how that dog's reacting, of do we have to increase, decrease, etc. To me, your veterinarian started off at the starting dose, at the low end of the starting dose, but it sounds like we've actually decreased that. So I wonder, is the phenobarbital level going to be low? But the nice thing about doing a phenobarbital level is it gives us an objective number of, are we giving too much? Are we giving too little? Are we outside of the therapeutic range, or are we more into the toxic range? Based on what you're telling me, I would bet that we're more in the sub-therapeutic range. The only way to know would be to test. So that's an important thing to do. For any dog with seizures, typically every 6 months or so, we're doing blood work just to make sure that we're not running into problems with the medications, and we're not, our levels aren't drifting out of the therapeutic ranges. Sure, in the early stages, we might be doing it a little bit more often than every 6 months to just make sure that we're not running into things sooner. So sounds like you're on the right track.
Okay, well, thank you very much for your time. I appreciate that.
No, it's kind of neat for me. I don't think I've ever spoken to someone in Oregon, so this is a first for me.
Oh, it's beautiful here.
Yeah, and on my, and I don't want to keep you. I know you've got a little one there, but on my Facebook page, I often get things like the top 10 places in America you have to see and stuff like that, and lots of stuff in the Northwest seems to show up for the guy that lives in Miami of things that I need to see. So
yeah, I highly recommend visiting. I'm originally from Michigan, so I moved out here for my husband, and fell in love with the mountains, fell in love with the ocean. We moved to the coast for my husband's job, and the dog we had at the time was a black lab, and she loved the water. And when she passed away, our dog just didn't want to swim anymore. She's not a water dog. So now whenever she goes to have fun, we go the opposite direction and take her up in the mountains to play in the snow, and she loves it.
Well, that's neat to have ocean and mountains all within driving distance. I got to get in a plane to see a mountain. So
Thank you very much for your time. I appreciate it.
Thank you. I hope it was helpful.
It was. Thank you very, very much.
Take care. Bye-bye. Hello, how are you?
Fine, how are you?
Doing well.
Good.
I guess tell me about Daisy, and tell me a little bit about Daisy, what kind of dog she is, the history, and then
she's a little mini long-haired dachshund. A little blue and tan. She had an IVDD episode beginning of January last year, and they put her on crate rest, and we do dachshund rescue, so we knew what we were dealing with. And within about 4 days, I had her out on a leash to go to the bathroom, and she just screamed, and I knew immediately what had happened. Got right to the ER. The surgeon, thank gosh, that night was coming in, and she operated on her, telling us a 50-50 chance. But she said, after the surgery, she said, I got a tail wag, and I'm really happy about that. She said she may never be 100%, but she said I'm really encouraged. So after 6 weeks, they checked her. We started acupuncture, we did PT, we did laser, we did the whole at Charleston Veterinary Referral, which is similar to your group. And she's been doing just great, but she has these periodic things. I sent you, I think, a video. I know it was really hard to get the video, where when you would rub her neck, she turns her head, and she'll do it for about 3 or 4 days, and then she's fine. You know, and we don't know if it's, the physical therapist said she's sensitive sometimes in her lower back end. This all affected her right side.
Right.
And she said, I notice she's tight down there sometime when I do a massage. And she said this, a lot of times neuro things, they feel like tingling, like your foot's asleep and it's waking up, and that's why they react. So I didn't know if it was that. It's happened probably about 3 or 4 times. And every time when I've gone in, of course, she doesn't do it when she's there. But they've just basically said it's kind of residual from, you know, her situation. But definitely seems to be neuro, and I'm not a doctor, but I mean, it does seem to be neurological. And when it happened the other night, my husband said, I'm just hoping something else isn't happening. So that's mainly why I thought I would touch base with you and see what your thoughts were.
So in the video that you showed me, it seems like it's every time you scratch her right side.
Right. And she holds her head she won't do it now for me, I know, but she kind of turns her neck into your hand. And then sometime when you brush her on the back right side, her tail kind of goes off to the side. It gets real stiff, and then she's fine. But I mean, otherwise she's out, happy, eating, no pain. I mean, she's not on any pain meds. And I've got some methocarbamol that they gave me at one point, and has to be refilled, but I didn't know if I should do that, you know, when she has these little episodes. And yet, like I say, she's not uncomfortable.
Right. And I think that's the most important thing. So, you know, until we can speak to them, it's hard to know exactly what they're feeling and what's going on. But from the video, I mean, if you didn't tell me anything about her surgery or that you had a concern, I would look at that video and say, gosh, she just likes that's the spot she likes, and she's turning into it. So the fact that she's not painful, the fact that, you know, neurologically she's doing great, I don't think that that's anything big to worry about.
Okay.
You know, there are certain conditions that if she were sort of scratching out here in the air as opposed to scratching here, but this is all just when you touch her.
Yeah.
I'm very confident in saying that I don't think it has anything to do with her previous back surgery, or that it means a recurrence, or that it means there's a problem with the surgical site. I don't think it's any of those things. My gut feel from the video is just she likes being scratched there. And, you know, is she more, I don't want to use the word itchy, but does it feel better some days than others, so that she's
and this is intermittent. Like, this just started happening again the last 4 or 5 days, and she has been scratching. The doctor's got her regular doctor has her on Apoquel, and of course we live in Charleston, so Charleston's itchy country, you know, but which I hate giving her that, but she's still scratching a little bit. And we thought maybe she was, because she twists when she's trying to get to her, you know, her side to scratch, where she's trying to bite herself on the side. We didn't know, almost like when we all pull a muscle. I didn't know if that was it or not. But and then, like I say, her tail does that strange thing sometime when you're brushing her. It's almost like you're hitting a nerve. Yeah, and it goes rigid.
But for us, when we pinch a nerve, or when, you know, we get a muscle spasm, you know, we hurt, we act like it hurts. You know, we vocalize. So the fact that she isn't doing any of those things, I'm very confident in saying, you know, that it's nothing to do with her previous surgery.
Okay.
So yeah, I mean, I'm glad she's doing well. So she was paraplegic. It sounds like you operated on her really, really quickly.
Right. We know, being in rescue, we know, we had her there within 20 minutes, and then thank God the surgeon was coming in that night. She wasn't a neurosurgeon, but she's general surgery. And so she operated within 2 hours, because we knew there was a narrow window. And they did say to us, you know, she had no deep pain. Right. And the fact that they have got her up walking, I think, is amazing. Because, you know, you can see her back right leg. She's still dragging it a bit. You can hear her little toenails. But I mean, she'll go full out. We have to really, we have to really control her because she sees a squirrel and it's all over, you know. So she's definitely regained the ability to walk and everything like that, which I think in itself is a miracle.
Exactly. That's a smashing success, and you know that's what the neurologists and surgeons wake up for in the morning. You know,
Right.
is that dog that only had a 50% chance of walking and gets better. So yeah, when a dog can't, as you know, when a dog can't move or feel the back legs, it's only like a 50% chance of walking
Right.
again. The sooner surgery can be performed, the better. Certainly within the first 24 hours of losing feeling. So you were on it right like that. And we usually
Right.
prep owners that it's a 50-50 chance, and that it's going to be something that if it comes back, or if walking is going to come back, feeling needs to come back. I usually give that about 4 weeks to come back. If it
Right.
doesn't come back in that time, it's not going to. You know, the fact that it sounds like she was wagging her tail by the time she left the hospital, you know, she's an A+ student. So
And she never lost continence, thank God. We had to do some of the expressing, which we never mastered, but they could do it right away at the vet. But she never lost continence. It's just if she maybe couldn't get up to go out fast enough, she would have an accident, you know. But we feel so blessed that we didn't even have to go through that, where they have residual incontinence and that type of thing. We never. So we've been very, very blessed. But my husband they said to us, when they did this, Dr. Schomper was the neurologist, and he's not there anymore, but he said, when he did the MRI 3 months after surgery, she was kind of going up and down with progress. And so the orthopedist said, let's let him do an MRI. And I sent you his notes. He basically said, it's just her. I mean, it's just her residual, whatever. And he said, now I can't say that she's not going to have anything happen, because he said, I did see, you know, I know there were probably other discs in there that were iffy, but he said, you may never have another problem. You know, so that's why we always are like, oh my gosh, is something happening again with another disc, you know?
yeah, and that's very, very typical. I mean, most people don't know that intervertebral disc disease exists until it happens to their dog.
Right.
And then once they're aware of it, every time the dog sneezes funny, you know,
Yeah,
we're
right.
worried that it's happening again, and it's completely normal.
Right.
So yes, a dog with a slipped disc, with one slipped disc, has about a 50% chance of having another disc problem at some point in their life without surgery, and with surgery has about a 10 to 15% chance of
Right.
having another disc problem at some point in their life.
Well, the thing I could kick myself for, and as I say, we work with rescue and everything, is probably about 5 months before this happened, she went into the ER because she ate something. And the doctor came out and said, well, everything looks great, but I want to let you know I'm seeing calcified discs and you might want to get pet insurance. And we were like, yeah, we need to do that. So the minute this happened, I was like, oh my God, I never got pet insurance. Like, we are the biggest advertisement for people with dachshunds getting pet insurance.
Yeah, totally.
So,
Every dachshund and every French bulldog should have pet insurance. I mean,
I
just
know.
It makes a world of difference for that pet parent that, you know, when they're faced with that
Decision.
yeah, $5,000 or $10,000 bill or whatever it is,
Right.
it takes that part of the decision making out of it. So
Right. We're very blessed, not that we're wealthy, but we're lucky that we had our MasterCard and just paid for it and everything. And then we've just gone ahead with anything they've suggested, with the massage therapy. And the nice thing is the physical therapist comes to the house. Our friends can't believe it. But anyway, she comes. So it's good because she's been with her since the beginning, and she can at least say, yeah, this is what I'm feeling, or I wouldn't worry about it, you know, that kind of thing. And I wrote her yesterday, and she said, I really don't think it's anything. But she's coming Saturday, and she'll do a massage. But the massage seems to really help, and the laser seems to be helping too.
Right.
So we've been kind of alternating that and just kind of playing that by ear. But we were just really concerned that something else was going on, that she was getting these episodes, you know, where you didn't see anything really happen, not where she jumped or she fell or anything like that. And she used to be a flying squirrel, so this doesn't surprise me that this happened.
Right.
But we're not letting her on furniture or anything now, steps.
all reasonable things to do is to, you know, we need to let them go back to being dogs, but
Right.
you know, we can't keep them in a crate forever, but we want to limit the high impact stuff like
Right.
jumping off
Right.
the furniture, running up and down stairs.
That's okay. I have it. Yeah. Well, we started the laser back in September because she had one of these things going on. And of course, my regular vet, she wouldn't do it with her. And she said, well, I don't see anything, but she said, why don't you try and see if the laser will help just a little bit, we'll do that. And who knows if it did or not, but we've been trying to alternate it. She is not a happy camper with acupuncture or laser. She's nervous the whole time. My husband said, this isn't worth putting her through this, whereas the PT, she adores. So we're kind of thinking maybe just keep going with the massage once a month, something like that, to kind of, it's good that she kind of gets to see her once a month and can kind of see how she's doing. Because she works real closely with the neurology department over there.
Of course, of course. Well, great. Do you have any other questions for me?
I don't think so. I know you think I'm crazy for this, but I just thought I would touch base with you and see what you thought, because I'm so impressed. Your Facebook page is wonderful and what you all are doing.
Thank you. Thank you. This is the one that does all of the Facebook stuff.
She had to talk me through my husband fortunately does IT, and he had to help me get set up here because I don't know what I'm doing. But anyway, I so appreciate your help and everything you all do.
You got it. Thank you for helping all of the dachshunds with the dachshund rescue.
Oh, sure. Thanks so much. I appreciate it. Take care. Bye-bye.